Today we have our panel is on COVID in Brazil. Our moderator is Professor Marshall Eakin. Marshall is Distinguished Professor of History here at Vanderbilt. Written a number of books, more books than I could list here on Brazil, but his most recent one is Becoming Brazilian, Race and National Identity in 20th Century Brazil. We're also very pleased to have one of our new affiliated faculty members, Professor Gustavo Goldman from the Universidade de Sao Paulo. Professor Goldman is a professor of biology. He just won a big award from the American Society of Microbiology, and he is a well-known, internationally renowned researcher on the evolution of fungi. Fungi or fungi, as I've learned that you can say either one. We also have Professor Antonis Rokas, Cornelius Vanderbilt Professor of Biological Sciences and head of the Vanderbilt Initiative of Evolutionary Studies Initiatives. And last but definitely not least, we have Professor Jessica Castilho, who is in the School of Medicine, an infectious disease expert, and has done extensive work on Zika, TB, HIV, and obviously with implications for COVID in Brazil. So without further ado, Marshall, I will turn it over to you.
Bom dia, or maybe it's boa tarde at this point. Hi, so I'm just going to say a few brief words of background, and then we're going to go to our panelists who are each going to have 10 minutes each to speak. And then when they're done, we'll have a little bit of time left for questions. For those of you who have to leave at 1 o'clock, that's fine. And for those who can stay past 1 o'clock, we can keep the questions going. So Brazil looks scarily like the United States, or maybe vice versa, when you look at COVID. The first cases of COVID appeared in Brazil in mid-February, late February, and they're linked to the outbreak in Italy. The first death in Brazil was in mid-March. They reached 10,000 deaths by early May. That doubled to 20,000 by late May. They have now reached the point where they've just been displaced in the last couple of days by India by the second largest number of cases. It's more than 4 million cases, and they're approaching 130,000 deaths. It looks a lot like the United States. In fact, maybe Gustavo will talk a little bit about this, in the way in which there's been basically, at the same time, no national leadership and antagonistic national leaders to the response in Brazil. So what you see in Brazil looks very much like the United States in terms of states and municipalities left to their own devices to handle the crisis. So first we're going to lead off with Gustavo, and then we'll follow, we're starting off with Jessica, and then we'll go to Gustavo, and then to Antonis.
Hey everyone, good afternoon. Thanks for the opportunity to speak. I'm going to go ahead and pull up some slides, and thank you, Marshall and Ted, for that introduction. These slides are really just to help paint a picture for some of those numbers that Marshall was just telling us about. I think most of us are aware of the dire situation in Brazil, but I wanted to show some figures and then also present one of the more important studies that have come out of Brazil, just to lay a backdrop of what's happening there and differences by region and ethnicity. So first I got to make sure this can work. There we go. Okay. So again, this picture of what COVID looks like around the world and where Brazil is. And just as Marshall was saying, how much it is parallel to what we're seeing in the US. This is data from around the world and all publicly available, looking at the average number of new cases per day over time. And what you can see is Brazil here in gray, tracking right along with the United States, and India now challenging both of these countries for the highest number of daily new cases per day. Additionally, as Marshall just said, Brazil is the second highest, though this may now be passed with India for total number of confirmed cases. And remember, this is just the cases that have been tested and confirmed to be COVID in the world, with more than 4 million cases since the epidemic began. But we have to take that with a little bit of a grain of salt, because we know, well, what we do know of testing, which is very limited in Brazil, because for a period of time, the government was not reporting on the number of tests being conducted in the country. But this just shows the daily number of COVID tests that are being performed per 1,000 people. So this is normalized, just looking at some of the major players in the hemisphere. And our data for Brazil is very low and limited. But what we do know is with limited testing, we are seeing those high numbers of confirmed cases, which really may be an underestimate. The number of cases and the number of deaths for Brazil is what's shown here. The top graph is the average number of new cases per day, similar to what we were showing before. And again, this is not really downtrending. This is kind of flattening off. And similarly, the number of daily deaths come down a little bit, but we're still very much in the thick of things in Brazil, and we're not seeing that epidemiologic curve kind of flatten and come down. Of those who have confirmed disease, what proportion of those individuals succumb to their illness or die? Again, the picture in Brazil looking very similar to what we see in the US. This is case fatality, meaning what proportion of individuals who are infected die of their disease. So Brazil here in the gray line, United States in red. Again, these curves are almost right on top of each other in terms of showing the change over time. Markedly different than what we see in, say, Mexico, which has a very high case fatality rate. And again, this is going to depend on a lot of different factors. It's going to depend on who's getting tested, who's getting diagnosed, and then what are the resources in terms of treatment. This is another graph that is a composite score, which looks at the stringency of the governmental response. And this is really looking at a national level, looking at policies such as school closures, workplace closures, travel bans, and it's rated from 0 to 100, 100 being the strictest governmental response. And again, we see this parallel with Brazil and the United States here, kind of at the bottom of the pack. So the least stringent among some of these other players in the hemisphere, and really, again, kind of tracking right together in terms of a similar governmental response. So lots of folks were worried very early on about what was going to happen in COVID, with COVID in Brazil. And that's because COVID is playing out at the intersection of a number of other phenomena that's Brazil is undergoing, and reasons why its population may be at even adverse or increased risk for poor outcomes. Currently, along with other areas in Latin America, Brazil is undergoing a rapid demographic shift, and an aging of a population, an increase in some of these comorbidities that we know are associated with worse outcomes with COVID. We also know that the country is characterized by a genetic admixture, insofar as differences by ethnicity or genetics may contribute to differences in disease outcomes. It's a country that's characterized by vast economic and social diversity, and that includes both within cities, but within regions and in areas in the interior in the country with much less access to healthcare, including things like ICU beds or ventilators. It's relatively low in ICU capacity. Most of that kind of higher level medical support is really concentrated in the major cities of São Paulo, Rio de Janeiro, and Minas Gerais states. There were questions early on about how might the tropical climate of the country, the relatively warmer weather, might contribute to the spread of the infection, which we worry about in infectious diseases. Areas within the cities, such as favelas, where there's dense living conditions and really not a lot of options in terms of quarantining and social distancing, which we know is important for slowing the spread of the disease. And then in the backdrop of all of this, the recent economic downfall in the country has resulted in large cuts to scientific research community. And so the research community and medical community to be able to respond and react to this epidemic has been undercut by the recent recessions in the country. And then, as mentioned, all of this was then further complicated by a federal governmental response, which touted policies and treatments ultimately found to be lacking benefit and in some cases even unsafe. So getting back to the regional differences, because Brazil, again, is characterized by nothing else but its diversity and heterogeneity. And this was an image that was published in the New York Times back at the beginning of Sao Paulo, and showing individuals kind of isolating themselves into their apartments. And indeed, Sao Paulo and Rio de Janeiro, the states with the two largest cities in the country, have borne the greatest burden in terms of overall number of cases. But all of the states have been affected, and that includes states in the north and in the northeast, which are much different than some of these south and southeastern states. So states like Pernambuco, Amazonas, which is much more tropical and in the rainforest, are also areas of concern. And that was the focus of a recent study that came out in Lancet Global Health earlier this summer, which focused on trying to dive into some of these differences in ethnic and regional determinants of mortality among individuals who were hospitalized in the country with COVID. So as a reminder for folks who don't work as much in Brazil, the Brazilian Institute for Geography and Statistics categorizes individuals into 5 different racial categories: white, Black, East Asian, Indigenous, and then this other race called Pardo, or mixed race, which is a mixture of obviously of multiple different races. And that population constitutes 43% of the overall population in the country. And so this study wanted to look at questions around racial differences and disease outcomes among individuals who are hospitalized. In Brazil, they have a national prospective database on all respiratory infections, and that's run by the Ministry of Health, called Sistema de Informação de Vigilância Epidemiológica de Gripe. And so they queried that database, which also collects information on hospitalizations for influenza or other viral infections, to look at patient risk factors, comorbidities, and symptoms that were associated with people who died after having confirmed COVID-19. And these were cases that were documented between February and May. So it's not going to capture those cases in these last couple of months. Some things about the study to keep in mind, which can play into some of its limitations, but things just to note, they only include cases of confirmed COVID-19. So folks had to have one of the PCR tests, and those individuals also had to have their ethnicity recorded. So if that wasn't recorded, the person wasn't included in the study, and that can be a limitation. Their outcome was hospital mortality, and what they wanted to look at was whether or not mortality varied by different regions in the country. So they compared the North and the Northeast together versus the South and Central areas, given known differences in education, socioeconomics, and racial differences across the country. And they used statistical models that were pretty complex to compare and basically balance some of these differences to try to isolate the individual effects of factors such as demographics, age and ethnicity, burden of comorbidities, the region, and then also to take into consideration some of those other system levels that can affect disease outcomes, such as the number of ICU beds, the number of nurses per million people in the population, ventilators, et cetera. So this was their results. They studied more than 11,000 hospitalized patients across the country, and that included more than 3,000 deaths in their time period. The overall burden, the largest burden of cases occurred in the Southeast. So this is the states down at the bottom. So SP is Sao Paulo State. So overall, the highest number of cases and the highest prevalence, the proportion of individuals per 100,000 people in the population was highest in Sao Paulo. But the other states that really led the way, highest number of cases, Minas Gerais and Rio de Janeiro. And then in overall prevalence, Rio de Janeiro and also Amazonas were the two with the leading prevalence for the population of those states.
So 1 more minute.
Okay. So just to wrap, I'm going to skip this. This is where they just show the differences in the proportions of ICU admission and death. But I'm going to jump to this last slide because I think this brings it home, where they looked at some of the different risk factors predictive of mortality. And so age, which we know is predictive of mortality, the more one of these dots is to the right of this dashed line, that means an increased risk. So older age associated with increased risk of mortality, but also they noticed this Pardo race, this mixed race being associated with increased risk of mortality. And that was after they controlled or balanced for some of these other factors. Black race was also associated with increased risk. And then lastly, when they looked at differences by region, they found that after controlling for other factors, these Northeast states, Pernambuco, and North states, Amazonas, I looked this one up, Paraíba, thank you. Also the outlier of Rio, so not in the Northeast, also being associated with increased risk of mortality, and Bahia, all having a higher risk of mortality. And actually Sao Paulo, where the greatest burden of disease was actually protective in terms of risk of mortality. So these were the conclusions, and I'll stop here, but they noticed that survivorship from disease associated with younger age women, those with fewer comorbidities. I just wanted to note that they noted this higher mortality for Pardo and Black mixed race. They did not invoke any claims that this was related to genetics. In fact, the authors very appropriately note that this racial difference is not due to race itself, but as we know, as being a social construct, that race is what places people at increased risk for some of these adverse outcomes. And this is probably a result of other exposures or other factors that these individuals are disproportionately affected by and increase their risk of mortality. So I'm going to stop there. We can talk more if folks want to about the study, but I wanted to give this background into the current epi data for the country. And I'll turn that over.
Thank you. Gustavo.
Okay. First to thank Ted and Marshall for the invitation. I just want to do a sort of personal account about the COVID-19 in Brazil. And first, a short historical introduction for those of you who are not familiar with Brazilian history in the last 50 years. From 64 to 85, we had a military dictatorship in Brazil. In 85, we had our first president, civil president, indirectly elected after dictatorship. And then, because the constitution in those times was a constitution that was granted by the army, by the military coup, by the dictatorship, Constitution 67, we had to grant another constitution, that was the Constitution of 1988. The discussion about the Constitution is central, essential in this discussion about politics in Brazil and about the combat of the COVID-19 in Brazil. And then this is a very important constitution that was called a citizen constitution because it's a total immersion in democracy in Brazil. That was a constitution for the future, to make the country completely democratic, you know. And then in 2016, we had a rupture of this process with a sort of coup, a parliamentary coup that impeached Mrs. Dilma Rousseff and then contributed to the election of the Mr. Bolsonaro in 2018 and the establishment of the fascist government in Brazil. Since 2016, we have a kind of process that was accelerated by the election of Mr. Bolsonaro. This process was aiming to destroy several articles of the Constitution of 2018. And since in 2016, there is a constant battle in Brazil between the legal system, the Supreme Court, the Parliament, and the federal government, fighting about virtually everything, you know. And Themis, the goddess of justice, the Greek goddess of justice that normally has a blindfold thing, and the Germans just introduced the scale to show the distribution of justice. In Brazil, right now, it's not blindfolded anymore because there's a lot of politics. There's a lot of influence of politics in the legal system in Brazil. But one thing that is very important that was created by the Constitution of 2018 is our single health system that is called SUS. SUS is essential. The Sistema Único de Saúde is essential to fight the COVID-19 in Brazil. That is very important. This is one of the largest health systems in the world. It can go from primary attention to organ transplantation. Brazil right now is the second country in the world in terms of absolute numbers of organ transplantations, and we are talking about 95% of the funding for organ transplantation comes from the SUS. SUS is really important. Without SUS, I think the COVID could be at least 3 or 4-fold higher, the number of cases and deaths in Brazil. And the principles are very simple: universality, equity, integrality, and solidarity, union states and cities administration. Then, like it was mentioned by Jessica, the first patient in Brazil arrived from Milan in February 25, 61 years old, a male. He recovered, but that was enough to spread the disease in São Paulo very quickly. And since then, there was a fight. In February 4th, the government sends the first bill regulating the COVID-19. All the restrictions were decided by the union. That's very similar to what happened in the United States. Then the Supreme Court ruled, said, no, there is a solidarity between the union, states, and cities. And then Mr. Bolsonaro said, okay, then we are not responsible anymore for anything. And then there was a bill passed by the Congress in June 10th that obliged the usage of masks everywhere in the country in public access place. And Mr. Bolsonaro vetoed, sent a veto to the law, to the bill, and this was overturned by the parliament. And finally, the Congress created a plan of protection of the native people and quilombolas. Quilombolas are descendants of black slaves who have been assembling in several small counties around the country. Those are vulnerable populations for us. And then again, there was a veto from Bolsonaro, and again, the Congress overturned the veto, and Mrs. Bachelet, the United Nations High Commissioner for Human Rights, protested against Mr. Bolsonaro veto. And then we had 3 ministers of health in this period, you know. Now the last one is a general, Pazuello, from the active service of the army, and 30% of the resource that were approved to be distributed by Minister of Health were used by the Minister of Health. Only 30%. Most of the resources were not used. Most of the resources are being used to buy raw material to produce hydroxychloroquine and chloroquine. We probably have the largest stock of chloroquine in the world in Brazil. What's happening in terms of legal consequence of the bad management of Mr. Bolsonaro? We have about more than 50 impeachment requests against Bolsonaro, most of them related to the management of the crisis, you know, of the COVID in Brazil. We have 4 trial requests in the International Court of Den Haag in Holland, making Bolsonaro responsible for genocide and crimes against the humankind because of his behavior during the COVID-19. But surprisingly, we are trying to produce vaccines, you know. That's the most amazing part of this story, because this very bad government provided at least some opportunity to invest in vaccines. We had participation in the Gavi, that is the public-private initiative, the Global Alliance of Vaccines and Immunization, coordinated by the World Health Organization. And we are one of the top countries in the world in terms of vaccine dose reservation for this year. We are talking about 220 million doses, 120 million from China, from CoronaVac, the Sinovac, from the CoronaVac, and 100 million from AstraZeneca, Oxford. And these 2 companies, they are going to transfer technology to Brazil, and we are talking about 220 million vaccines in terms of production and importation. And those are very important agreements for technology transfer. And then we have 5 vaccines in phase 3 registered by Anvisa, that is the FDA-like agency in Brazil, going on these clinical essays. I just want to mention very quickly, because the time is a problem, you know, about what Jessica said concerning the funding of science in Brazil. 95% of the scientific production occurs in Brazil at the public universities and institutes, you know. We probably are in the position 13th, 14th in terms of scientific production. We have very advanced areas of agriculture, engineering. We have good science in Brazil. And we have a kind of national fund for science and technology. This year, the fund has $1 billion. And Mr. Bolsonaro government has held 88% of the fund. It's going to release only 100 million. And then there is more than 20% reduction of the budget for the public universities and institutes, about $2.5 billion, only in 2020. I just want to finish because a few weeks ago, there were 2 lives shows from Caetano Veloso and Gilberto Gil. For those of you who are fans of you know, folk music, you know, popular Brazilian music, Gilberto Gil and Caetano Veloso are probably the most important artists in Brazil. And then everybody was really thrilled about that because Caetano Veloso said, we have to donate. He opened his online, you know, thing just to get money to the folkloric ballet of Bahia. He said, we cannot destroy the Brazilian culture. Thank you.
Antonis.
Should I go next?
Yeah, go.
Hi, everyone, and thank you for the invitation. I'm going to be the briefest of all because I don't have that much familiarity with the situation in Brazil. But I'm an evolutionary biologist by training, and I'm interested in developing tools for the analysis of genomes and comparisons of genomes. And so my interest in COVID-19 and the ongoing epidemic is in the development and use of tools for understanding epidemics. And so, for example, there was a recent study that appeared in Science where they're analyzing the genomes of COVID-19 patients from a widespread and representative sample from Brazil. And so they were able to identify using evolutionary tools, you know, more than 100 independent invasions or invasions of COVID-19 infections from internationally into Brazil before the origin of any strategies such as mask wearing or travel bans or anything like that. And so I'm interested in how evolutionary approaches can inform us about the spread of epidemics. And you can think of Brazil or Greece, where I'm from, or the US and so on, because of the different rules that govern each country as sort of a different island in which evolutionary experiments are being played out. And we can, you know, potentially sort of take advantage of the different strategies to sort of identify what works best and what doesn't work. And I think it's clear what's working best and what is not working. And I think the 2 previous speakers have spoken a lot of that. I'm also the director of the Evolutionary Studies Initiative here at Vanderbilt. And this is a project that sort of aims to unite folks interested in evolution on campus and beyond in the local community. And one of the things we're trying to do is develop a course called Contagion that uses COVID-19 as a model for teaching undergraduates on all aspects of, from the point of, you know, how do we detect these epidemics all the way to how do we inform the public, how do we prevent or spread, and so on. And then finally, I'm a collaborator with Gustavo Goldman for the last few years, and it's through him and our collaboration that I've come to be more familiar with Brazil and its wonderful culture and science. And one of the things that we're studying is these aspergillus fungi that cause lung infections. And our research has taken a new twist. Usually these are infections that are affecting individuals with compromised immune systems. So individuals that have experienced cancer, and cancer has suppressed their immune system, or individuals that have undergone transplantation surgery, and again, they're on immunosuppressants. And so they typically don't affect healthy individuals, but in the age of COVID-19, what we started noticing, or rather what medical doctors have started noticing, is that some of these fungal infections that are sort of relatively rare in the general population appear as super infections of COVID-19 patients, especially those in ICUs. And so we've started identifying in strains of these fungi that are infecting COVID-19 patients around the world. We've had our first isolates from Germany, and we're trying to obtain more isolates from Brazil so that we can understand the epidemiology of all these additional infections that COVID-19 patients may be experiencing. Also, I'll stop there and I think get it back to Marshall so that he can open the floor for questions.
Thank you. So, questions. We've got time for questions now. So raise your hand either, I guess, digitally or in person. Ben.
Hello, everybody. Happy Brazil Week. And this is just kind of a general question for those who have been collaborating with people in Brazil, or for Gustavo in Brazil. Something I've noticed when I communicate with some Brazilian friends and colleagues is that there is a sense that in the United States, we have this under control in a way that they do not in Brazil. And I was wondering if anybody has had that kind of sense or encounter, and what the Brazilian media is reporting about that, because I'm always shocked when it's like, oh, well, you don't know how bad it can get, because here in Sao Paulo, and I'm like, well, actually, I live in Nashville, and we had a 21% positive test rate back a month ago, you know, So, yeah, just if anybody wants to kind of add to that, or if anybody else, you know, not just the speakers, but anybody else who has had these conversations in the past few months, you know, if you've noticed that. And I will mute myself.
I can comment on that, because for me it's very easy. I have a daughter who is living in Chicago. She's American and she lives in Chicago and works in Chicago, and I spend most of the time worried about her. She's 25, you know, she goes out like she's a superhero, you know, she doesn't, I mean, she's protecting, she has masks, but anyway, I think most of the educated people and people who think about it, they know that the situation I say is not good. That's my feeling. I think I would say that people at the university know that the situation I'd say is very comparable to here, you know. What they don't know and they don't think is about the health system in the States, you know, how this health system, because health system is paid in the States, you know. And here it's not paid, it's for free. If you have a problem with COVID, you are going to ICU bed without paying anything. Now just we had a law about the health plan systems, the private ones, they are obliged to pay for the tests, you know, both the RT-qPCR and the antibodies, you know. I think people don't know very much about the health system in the States. They don't have this comparative thing, you know. But I think a lot of people know this about the situation in the States. That's my feeling, at least. Maybe Jessica can comment about that.
I'd say the similar, and most of my colleagues are infectious disease doctors in Brazil, so they're pretty aware of the situation in the US. So support group when we talk. But honestly, there's some of them are very busy, and the communications I've had with them have been very brief, because many of them, especially my colleagues in Rio, are very much on the front lines in all of this. And so many of them are very, very busy. I haven't had a chance to talk to them.
And, you know, just to kind of respond back to that, that's something I hadn't even really thought about with this, because the people that have brought this up. I'm not going to say that they're not educated people, but they're not they're not in a university environment necessarily, and it might be a different, general just reaction. And I know that in São Paulo capital, it's been. I know more people who live in São Paulo who have had COVID than I know in the United States in general.
Yeah.
So I know that it was a very widespread thing there for a while, a few months ago.
May I comment on that? I think yesterday, like for you guys, we had a kind of holiday here. It was just the Independence Day here yesterday, and then I think people are really fed up. They are just crazy about staying home. They don't care. In São Paulo, the rate of utilization of masks was very close to 100%, 98, 97%. But before yesterday, this weekend, people, they just went crazy, They don't care. They went to the coast. And I think people are really psychologically fed up. And some people, they think the infection is gone because there is more stabilization. The numbers are going down in some states. And I think they have the feeling that the vaccine's coming, everything. They don't think about the situation. At least I don't think they want to think about the situation. No?
Earl, did you have a question?
Yes, please. Hello to everybody, and thanks for the wonderful presentations. Julita and I here were wondering about COVID-19 in Brazil and in the rest of the world. Is there anything unique about COVID-19 as an infectious disease, or is it a well-known kind of virus, or does it portend, looking into the future? Do we know anything about that?
You want to comment, Jessica, or?
Sure, I can. I'm also sitting up here with biologists who you guys may not know as well. But yeah, so this is a new virus to humans. That's why it's a big deal, because as a species, we have not seen this virus, but it's part of a family of viruses that's called the coronavirus family. And that is a family of viruses that we have known before. It's the same family of viruses that the SARS virus came from. So that's how this virus got its name, SARS-CoV-2. It's related to those other, to MERS and SARS, and so those other viruses that have caused outbreaks in the past. There are more of these viruses. We think that this one likely came from a zoonotic infection, meaning coming from animals. And some animals, in particular bats, are able to harbor many of these viruses, and they're waiting for an opportunity to jump species. So yes, we will see more of these. And I mean, for some of our colleagues here at Vanderbilt, Mark Dennison's lab in pediatric infectious diseases has been studying coronaviruses forever. They're real leaders in this, anticipating that we will have these outbreaks because we know these viruses are in animals and they just need an opportunity to jump species.
If I might follow up on that, so that makes the political question, which you all referred to, research or funding for scientific research, all the more important now and in the upcoming years. We're going to, and that of course is a function of taxes for all of us. So that's the political question is going to become more and more important as the decade goes on. Am I correct in assuming that?
Yeah.
It's political will. These, it's whether or not research funding mechanisms are prioritizing researching something that might happen. And obviously that's competing against everything that is happening. And there's a finite amount of funds, and
right.
That's where these political decisions make a difference for sure.
We
Thank
might
you.
even, if I could jump in and build on that, Earl, it's good to see you, by the way.
Good to see you.
Maybe in your list of risk factors there, Jessica, we could add political polarization. It's one thing that the US and Brazil hold in common right now. And if we look at countries such as Northern Europe, which don't have much political polarization, and their response has been much better. So we might think about some of these political and social factors as real risk factors, along with type 2 diabetes, obesity, et cetera, et cetera.
Yeah, I think the main problem, that's not only a problem in Brazil, it's a problem in many countries, is how to bring together science and technology to the politics of states. Now, people like Bolsonaro, Trump, and the guy from Belarus, and other people in Hungary, they are just now in power, but they are not the state. The state is something more continuum. And then how to bring science and technology, a plan of science technology together with the state administration, that is the tricky. For example, I don't know if you guys know that there are about 184 slaughterhouses in Amazon. 184, that's a lot. And you know that COVID spreads much quicker in slaughterhouses, because there are many evidence in the States, in Europe, in Brazil, and then you have a lot of destruction of the forest in Brazil. Why you need to destruct forests? If you have destruction of forests in Brazil, you're going to have a lot of wild animals, and this virus that Jessica commented, they come from wild animals, and then you have 184 slaughterhouses in Amazon closer to these wild animals, and the virus, they are going to jump to this concentration of immunologically completely devastated, animals, birds, and inside this slaughterhouse. I mean, you must be really an ass not to plan things. It's so obvious what's going to happen, because we have bats, you have a lot of wild animals, a lot of possibilities of, statistically speaking, of transmission, horizontal transmission of virus from wild animals to animals that normally we eat in our diets, And I think that's the main problem. For example, we had one of the most important programs of imaging for evaluation of destruction of forests. One of the first things that the fascist government decided to do was to destroy the program. It's completely destroyed. That is an institute we are talking about that took us about 25 years to construct all the science and technology in this institute. That's the INPE in São José dos Campos. And then I think we don't have mechanisms to protect rationality in the state. And that's a common problem, not only in Brazil, but everywhere.
So one of the kind of growing conversations I've seen from people here are about trying to raise awareness about vaccination. And when we come to that, to make an all-out push, is that something that registers at all in Brazil? To the extent to where like the medical establishment feels like it needs to do a comparable amount of politics to like
May I reply to Celso? Celso, basically, I think we have a very good plan of immunization in Brazil. This has been for decades in Brazil. We are very competent about immunizing children, immunizing adults. We are really good about that. We produce most of the vaccines that we need in Brazil. The problem, of course, there is some effect of these groups, anti-vaccine groups, but I'm not sure if this is the main problem in Brazil right now. But of course, some vaccines, we had a decrease in terms of adhesion to the vaccination. We don't know exactly the cause of that. Some people are studying why. Maybe it's just because people, they thought, oh, these diseases are not present anymore. And these diseases, they come from time to time, like yellow fever. Yellow fever was completely gone. And then suddenly about 10 years ago, we had epidemics of yellow fever in Brazil. These things happen, you know, we have to vaccinate. There's no, but people, they just get relaxed about things. I don't think it's really strong anti-vaccine, groups in Brazil. But for example, last week there was a statement from our president saying that nobody is obliged to take vaccines. You know, some people were asking him if the government is going to oblige people to get vaccinated because, you know, everybody knows that you need 10 to 15 years of time to have a safe vaccine. Am I going to be obliged to be vaccinated? And he said, no, nobody can oblige you to get vaccinated. And he signed a bill saying that we can oblige, the government can oblige people to get vaccinated in the case of COVID, because that's a war budget, a war law. That's really serious. No, he signed that. And then in our law in Brazil, there are several vaccines that we, children and their parents, they are obliged to take. Then I think it's just ignorance, completely ignorance from a leader. A leader cannot be ignorant. I can be ignorant, but not a leader.
Well, as a historian, I got to say, there isn't a precedent in Brazil for revolts against vaccines. And that's how Oswaldo Cruz got started.
Oh, yeah. There was actually a revolution, the vaccine revolution. That was in 1910. 1910, people, they just get really pissed because the agents from the government, they were trying to invade the house just to apply DDT to protect against ticks, and flies and things like that. And then, like Marshall said, there was a revolt.
Well, I'm not a scientist, I'm not a doctor, and I know nothing about public health, but it seems pretty clear to me in all these cases, we know what's happening. The more we get together and the less we wear a face mask, the more this spreads. The less we get together, the more we wear a face mask, it gets weaker.
My last comment is about leadership. I think leadership, of course, in every activity, human activity, is very important to have good leaders, But the COVID-19 showed to us that leadership is the most important thing, And I don't know what's going to happen because the COVID-19 is just the beginning, More things will come, for sure, And then we need more, solid budgets to health. We need independent decisions from the government to health, things like that,
Well, thank you to our panelists, and
Thank you all.
guys who zoomed in with us for showing up.
Bravo. Obrigado.